The views and opinions expressed by guests on Soda City Unleashed are their own and do not necessarily reflect those of CVets. While we love sharing stories and insights from the veterinary world, this podcast is for informational and entertainment purposes only. It is not a substitution for professional veterinary advice, diagnosis, or treatment. We always recommend consulting your primary veterinarian for any medical concerns regarding your pet. Welcome to Soda City Unleashed, where we decode pet health with some of the best vets in Columbia, South Carolina. I'm your host, Emily White, and joining me today is veterinary neurologist Dr. Patti Lawler. Welcome. How are you, Dr. Lawler?
Good. Thanks for having me here.
Absolutely. Thank you for joining us. Tell us a little bit about yourself.
Yeah, so like you said, I'm Dr. Patti Lawler. I'm one of the two neurologists here at CVets. I've been here for about 2 years now and loving South Carolina. But originally, it takes a lot to be a veterinary neurologist and a lot of training. So I originally went to veterinary school at the University of Florida and then was actually in general practice for a few years before I decided to specialize in neurology. So then I did two year-long internships kind of scattered throughout the Southeast. And then it ultimately ended up at Cornell University in upstate New York for my residency in neurology and neurosurgery.
What made you want to specialize in neurology after being in general practice?
So I knew I had always liked it. So it was something you get exposed to in kind of bits and pieces in vet school. And honestly, the first time I had been on clinics in my neurology rotation, we made a paralyzed dachshund walk again. And I honestly thought that was the coolest thing ever. Also being out in general practice, kind of get outside of the academic bubble and more kind of in real life and what people are dealing with on a daily basis with neurologic conditions from seizures to paralyzed dogs. And it really seemed to be a very stressful condition for owners to try to deal with. So that was also a motivating factor, is I can actually help these animals and these people with their dogs that have these diseases. So
that's awesome.
Yeah.
That's awesome. And to specialize, it really does take quite a lot of schooling. And,
it does.
And so how many years between when you were in general practice to when you were able to become like a practicing?
So 6 years.
Wow.
Yep.
Wow. On top of veterinary school.
Yes, on top of veterinary
and all
school.
that.
Yep.
Love that. All the education. Okay. Well, with all that education, will you tell us your top 3 pieces of advice for pet owners from a neurologist standpoint?
Yeah. So I think my perspective honestly comes from both neurology and being out in general practice, but I think a really big piece, especially being here in South Carolina, that I honestly wasn't expecting so much, would be to definitely make sure that your pet is on year-round flea and tick prevention. Mm-hmm. We unfortunately see, especially in these spring and summer months, see a lot of tick-borne diseases. So keeping your pet on a oral or even the topical flea and tick preventative doesn't completely eliminate their risk, but definitely can decrease that chance of them getting a serious infection of their brain that ticks can spread.
Interesting. I didn't realize in humans, Lyme disease, right? Mm-hmm, that's the big one. But
yeah.
What
so I would say, even though it's called Rocky Mountain spotted fever, myself and Dr. Bond, our other neurologist, have quite a few Rocky Mountain spotted fever encephalitis dogs here, wow. Which is treatable, but it's definitely a long course of treatment. So
and something that can be prevented.
Yep.
All right. Well, what's your second piece of advice?
I think just in this growing day and age of lots of people having pets and the medical field booming as far as so many more medical options and treatments that seriously looking into pet insurance for your animal. There's lots of companies out there. There are lots of different levels of coverage, even if you can't afford the kind of Rolls Royce of coverages. Personally, I'm very thankful that I did that for my first dog in vet school. He went acutely blind out of the blue. He was normal in the morning. I came home from a test and could not see out of either eye.
Oh my goodness.
And thankfully, I had him on pet insurance. And we were able to do kind of some experimental but pretty expensive surgeries on him, and we honestly saved his life and saved his vision. So he had vision, and I definitely would not have been able to afford that as a veterinary student without pet insurance. So I definitely think it's worth investigating for owners.
Absolutely. And it's just that peace of mind too, just in case, because you never know when something's going to happen.
You can't prepare for emergencies, even though you think you can. And having that extra kind of just security blanket that you may be able to do more than you otherwise would be for your pet can really go a long way.
One of our surgery interns told me that he had a dog named Biscuit, which is my dog's name, so of course love for biscuits. But his dog had brain surgery, and it was covered by pet insurance. Brain surgery, something that you guys do in the neurology department. Okay, third piece of advice.
I think a big thing to consider is when you are looking into getting mostly a dog. There are kind of purebred cat breeds out there as well, but if you're looking to get a purebred dog, just doing your research about what those breeds are predisposed to. We're definitely seeing, and my personal favorite and love of a boom of a French bulldog, but just kind of knowing what conditions, especially in my realm of the world, neurologic conditions they can get. That way you're just kind of can make better informed decisions and be a little bit more prepared for their potential care. There was one study that came out not too long ago that said up to 80% of French bulldogs will have a neurologic condition in their life. So something to definitely consider, and again, just kind of weigh your pros and cons of knowing what you're getting into.
Absolutely. And you can kind of speak firsthand on that. You recently acquired a very cute pug.
Yes.
And there's things you have to look into when doing that.
Yep.
Your sweet Sandy had to have airway surgery because, that's just something with the breed. They can't necessarily breathe very well. So, doing that research is very important. Especially, I always think about when I see people with German Shepherds. I'm like, surely you live on a bunch of land and can run that dog around. That is why I got a Shih Tzu who lays on the couch all day. That's great advice. So what are some of the most common reasons a pet would need to see you in the neurology department?
So I would say kind of biggest couple things we see a lot of seizures. So seizures can happen for a plethora of reasons in dogs, but it is fairly common condition, especially in young, otherwise healthy dogs. They can get things like epilepsy, which is just a genetic predisposition to having seizures. So we see a lot of seizures. I would say neck and back pain is pretty common as well, especially as people are getting kind of smaller breed dogs, the Frenchies, the Dachshunds, Corgis, things like that. And then progression of that disease is paralysis. So paralyzed dogs we see quite commonly as well. But we can, like I said, do surgery and improve their chances of walking again. So those are kind of the biggest ones we see. We treat a lot, brains, spinal cords, and then people don't tend to think as much about the other diseases we can still treat as well. So we also can treat things that are affecting kind of outside the central nervous system and the nerves and muscles as well. So it's a lot of things we can diagnose and treat.
I know you guys a lot of times when I come by your department and just say hello, have dogs that are down in the back, paralyzed, a lot of just painful, like you were saying. What are some of the weird, random things that you only see every now and then, but are very much a neurological issue?
So those would be the kind of the things I was alluding to as far as, so we can see something called neuromuscular disease. So that's actually outside the spine and brain, and it's where all of those little nerves start to communicate with the muscles. And so they can present as basically just diffuse weakness because those muscles and nerves can't communicate to one another. But those can be pretty rewarding because there's some very treatable conditions that can look like that. Other than that, we see sometimes some interesting birth defects occasionally that we'll treat. And what else? I'd say that's
about it.
Yeah.
What would you say is a common misconception about veterinary neurology?
I think there are kind of two I would touch on. I think the first one's not really a misconception. It's just more about lack of awareness. So I think a lot of people just aren't aware that we're even a specialty. So when people ask me what I do, just out at the grocery store or whatnot, a lot of people seem to be surprised that veterinary neurology exists and that we can do those things for pets like you would have done if you had a neurologic condition. So I think it's just lack of awareness that we're a thing, and that we can do a lot of things to help. That kind of ties into my second one, is that I feel like a misconception is that if your dog has something scary like a neurologic condition, that there's nothing you can do about it. Even the worst case scenario, if your dog has something like a brain tumor, sure, there's definitely treatments we can offer to definitely extend your dog's or cat's quality of life and try to tackle the tumor. So I think that's another misconception, is just that even the paralyzed dogs, is there's nothing you can do about it, but we definitely have options and treatment plans.
It's kind of insane seeing some of the before and afters from your work. How something as like how long is a hemi surgery? Like
hour and a half.
That right there can just completely turn a dog's life around. Yep. It's incredible. Yeah, I can imagine that people who aren't familiar with the veterinary world, when you say I'm a veterinary neurologist, are like, excuse me, what?
Yep.
You do, huh?
Yep.
Like, yeah, no, really. Veterinary neurologist. Something Dr. Bond told us on her episode was that you guys mainly see dogs. Like, it's pretty rare that you see a cat.
Yeah, I'd say that's also a misconception, is that either people feel like cats don't get neurologic conditions that are treatable, or they don't need neurologists. But yeah, I think it's definitely, they definitely have neurologic diseases we can treat. So yeah, but we see a lot more dogs than cats.
Would you say like that cats are more flexible and so they don't as often get the paralysis stuff that the dogs have?
Yeah, I think it's part genetics. Fortunately, like I was alluding to, we don't see a ton of purebred cats. Some purebred cats can get disc disease, just like your dachshunds and Frenchies, especially kind of the smush face, so the Persians and the other types of purebred cats. So I think that plays a big component in it. And then, yeah, I think they're just also more likely to be getting into things, kind of being outside and picking fights with animals. So more of the neurologic diseases we see tend to be kind of infections or trauma related than kind of your more genetic, what they're predisposed to.
Absolutely. Okay. Well, in your time being a veterinary neurologist, but also just a veterinarian, what would you say is one of the most rewarding cases that you've worked on?
So as we've kind of touched on already, one of the reasons I'm in this profession, especially neurology, is just how immensely rewarding it is when things go according to plan and our treatments work. So I think one of my favorite parts of neurology is honestly the spinal surgeries, especially when we're talking about neck pain and intervertebral disc disease or herniated discs in the neck. We have one dog in hospital right now. They come in just excruciatingly painful, and we can do an MRI and surgery to address that herniated disc. And they don't all turn immediately around the corner, but I say majority of them within a day or two are just remarkably more comfortable, like nothing even happened. So that is probably becoming one of my favorite procedures to do. Another case I can think about is a little dog. I believe he was a toy poodle mix, tiny little guy. I think he was 2 kilograms or like 4 or 5 pounds. Had transferred to me from another emergency hospital without a neurologist because he had been stuck in a seizure for 2 or 3 days.
Oh my goodness.
His temperature was very, very elevated, which we can commonly see if they do get stuck in a seizure. It's called status epilepticus. And basically all of the veterinarians had painted a really grim picture for the owner, which was not unrealistic, but the owner elected to kind of give me one last chance to try to save, his name was Chewy, to try to save Chewy. And he stayed hospitalized for several more days, but with addition of multiple anti-seizure medications, we honestly pulled him back from the brink, and he went home and lived a fairly normal life on his seizure medications for several years.
Wow.
So seizures can be very frustrating to treat, and it definitely doesn't take the faint of heart. But that one was definitely very rewarding to go from a dog that had little chance to live to living a pretty normal life on a seizure meds. So
wow, stuck in a seizure.
Mm-hmm.
So that means like they're not moving.
They're unconscious, paddling, or just rigid. So all of their
gosh.
muscles are tense. And so the biggest concern there, so it's considered status epilepticus if they're stuck for longer than 5 minutes.
Wow.
And he had been in it for 2 days.
2 days.
Yep.
Oh gosh, that must have been so hard for the owner.
Yep.
And to swoop in and be like, we got this. We can
Yep.
do this. That's
Yep.
awesome. Wow, that's beautiful. Has there ever been a case in your career that has just completely surprised you?
I will say my techs like to pick on me a little bit that I definitely get curveball cases sometimes. So we'll be expecting something very straightforward, and I think that's actually just kind of the nature of veterinary medicine in general as well. But one I can think of when I was actually in one of my internships was this kind of young lab who all of a sudden got just severe neck pain, kind of like we were talking about, and just like could not move his head without yelping. So we're like, okay, like this could be a disc rupture, this could be an infection in his spine. So we did the next level of testing, which is an MRI, to look and see what was exactly going on to cause him pain. The spine itself, spinal cord, all the nerves looked completely normal. And then kind of in the MRI imaging, we get, since we're in the neck, we get some of the images of the other structures there. So like the breathing tube, the trachea, the esophagus, the feeding tube. And we noticed that there was something quite large stuck in his esophagus. And so asking the owner further about kind of had he eaten anything he wasn't supposed to, in classic young lab fashion, he had actually eaten an entire birthday cake, including a plastic happy birthday like topper with the big pokey stick. And that was what was stuck in his esophagus.
And causing him neck pain?
Yep.
Oh, my goodness.
Our surgeons were able to go in and remove that, and he healed and didn't look back, but hopefully not eating any more birthday cake toppers.
I think if I were the owner, I'd be a little relieved that it wasn't anything neurological. Just a foreign body for a lab. I bet you guys too are just like all right, pass this on to y'all. Gosh. Oof, goodness. What would you say is one of the funniest things that's ever happened to you? I know a lot of times things are very serious and you know, you're dealing with lives here, but sometimes, you know, you get an anal gland and it's pretty funny and
yeah, I think we have to, like you said, we have to find humor in the dark times sometimes. I'd say one of the funniest moments that just comes to mind was this very sweet and concerned owner that brought me her, I think 2 or 3 year old husky, and she was convinced that her house was haunted. Because he was seeing ghosts. And of course, as a veterinary neurologist, my first thought is not paranormal activity. It's something going on in the brain, most commonly. So asking her more questions, he would wake up in the middle of the night when the room was dark and then just stare into a corner and bark. So, of course... I
would have came to that conclusion too.
Of course, she thought that there was something in the corner that the dog was seeing and protecting her from. Turns out we did some tests and kind of asking further about these episodes, figured out the dog was actually having focal seizures. And so we started him on some anti-seizure medications. And the episodes didn't completely go away, but in the first few weeks went away. And so she called us a few weeks later and was relieved that her house was not haunted because her dog had been sleeping through the night and wasn't seeing any more ghosts.
So explain to me what a focal seizure is.
So seizures are just rogue electrical activity in the brain.
Okay.
They're kind of 2 types in dogs and people. So the one everyone thinks about is kind of what we call grand mal or generalized. So that's when they're unconscious, they're laying on their side, paddling, urinating, defecating, foaming at the mouth. So that's kind of the more classic, obvious type of seizures. But there are kind of smaller seizures that don't take over the whole brain. just a rogue electrical activity in one part of the front of the brain. And those can look like a lot of different things in dogs and cats. Cat seizures can look very, very wild and drastic depending on the cat, but pretty common focal seizure signs are kind of the waking up out of sleep, staring, kind of being alert enough to be standing and aware, but not like responsive to the owner if you were to call their name. They'll occasionally get like a facial twitch, can definitely vocalize. So that's kind of the harder to diagnose, but definitely still seizure activity.
Man, right. I bet, thinking of that instance, I'm sure you come across many theories of why animals are acting the way that they're acting. Yep.
And it can be hard. I'd say if your dog is a good tip, if your dog is doing something or cat is doing something weird that might be neurologic, videotaping can be very helpful. It's definitely not the first thing any animal owner thinks of doing when their dog or cat is doing something stressful, but we can definitely look for more subtle clues as to what might be going on to kind of give us a better idea of if this looks like seizure activity versus something else.
Because the odds of that animal doing it in the room with you when you walk in are very, very low.
Yep.
Interesting. So you're also you're a veterinary neurologist, but a medium too.
Yeah, I was going to say I'm ghost busting, but...
Add it to your resume.
Yep.
I mean, I'm now thinking, I actually watch a lot of paranormal TV shows. My husband, fun fact, likes to watch Paranormal Caught on Camera, a specific show on Discovery Plus. Shout out. Before we go to bed at night. Yep. So that's fun for us. But I'm thinking of all the times people have thought that their animals were seeing ghosts, but they might just need to go see a neurologist. Yeah. Yikes.
I'm not ruling it out, but
yeah. Could also be ghosts in the home. All right. Well, okay, silly question. What is one veterinary superpower you wish you had? So like talking to animals. Oh, you know what? That one you can't choose that one.
It's like everyone's gonna
I think
say that.
everyone wants to be able to talk to the animals. Or like seeing through fur, being able to like do the MRI with your eyes. Like, is there a superpower you wish you had?
I think predicting the future would probably be a helpful skill to have. More so just like knowing if what I'm recommending or doing is 100% gonna work. That way I can give owners a bit more peace of mind. Obviously with medicine there's always slight uncertainty, so that would be a neat skill to have, is being like, yep, this is
absolutely gonna work. I've seen it. If I had a regular superpower, it would 100% be teleporting, because when I'm really tired I just want to like snap my fingers and be in bed. Wouldn't that be incredible? Mm-hmm. What would yours be?
Probably flying. Yeah. So similar, but
yeah, I love that.
Although I'm scared of birds, so that may.
So you would probably run into a lot of birds up there. Okay, you have to choose another one. Going invisible and just listening. I love hearing any kind of gossip. So being invisible, like on the wall. No, okay, maybe. Yeah, maybe. Anyway, well, thank you so much for joining us. This has been really insightful, and we appreciate you coming on the podcast. Yeah. Until next time, give your pets an extra pet from us, and thank you for joining us for Soda City Unleashed.